Cancer is a scary word, but it's important to check in with your body every now and again and know the symptoms, especially if you think you're seeing some warning signs. It's estimated that over 53,000 people will be diagnosed with some kind of oral cancer this year, and that over 10,000 will die from it. And unfortunately, men are twice as likely to get oral cancer than women. Early detection is key when battling cancer, but you can protect yourself by knowing the signs and symptoms of oral cancer and knowing the ways to minimize your risk. Oral cancer accounts for about 3% of all cancer diagnosed each year. While that number may seem small, it's still important to know what to watch out for, especially if you're male. In today's video, we're going to tell you what the symptoms of oral cancer are and ways to minimize your chances of getting cancer in the first place. Will my diet make a difference? Is difficulty chewing a symptom? Does sun exposure have anything to do with it? We're talking all this and more, so keep watching until the very end. Symptoms of oral cancer. Like all cancer, the symptoms can vary from person to person, but if you're experiencing more than one thing on this list, it's probably a good idea to get it checked out. Remember, early detection and diagnosis is key. The most common places for mouth cancer to occur is the tongue, the tonsils, the oropharynx or the gums, floor of the mouth, or other general areas inside the mouth. Other likely areas are the lips, minor salivary glands, and other places. Number 1. Mouth sores. This is one of the most common signs of mouth cancer. Do you have a sore in your mouth that just won't go away no matter what you do? This can also include a sore on your lip that won't go away either. If yes, then it might be time to follow up with this symptom. Another common sight is white or red patches on the tonsils, roof of the mouth, gums, lining of the mouth, or frequent mouth bleeding. Number 2. Pain. If you have consistent pain in your mouth or throat, that could be cause for alarm. This can also mean those mouth sores we mentioned earlier. Just a sore throat alone can be many different things, like the common cold or a throat infection, so you don't need to assume it's cancer right away. But if it's coupled with a few other things we're listing, go get checked by your doctor. Number 3. A growth in your mouth. A growth in your mouth means something like a bump or a raised area that wasn't there before. This can be anywhere inside your mouth. You could also feel a lump in your throat that won't go away. This could possibly indicate a tumor. Like a lot of cancers, a tumor is a common symptom and mouth cancer is no different. Number 4. Problems with your teeth. We're not talking about cavities here, we're talking about your teeth feeling loose, without any apparent cause as to why. This can also go for those wearing dentures. They can be difficult to wear, or they may feel more uncomfortable than usual if mouth cancer is an issue. Number 5. Pain in your ears. You could also experience an earache as your ears are connected to your nasal passages and throat. If something's going on there, the ears could be giving you a warning sign. Even if you experience pain, you should not lose any ability to hear out of the sore ear. Sometimes the human body is a little strange and will give you an indication that something is wrong in a completely different part of your body than the one that's affected. Number 6. Abnormal mouth functionality. This could include difficulty when it comes to moving your jaw or your tongue around. You may have limited motion or experience pain when you do try and move. This can also mean you have difficulty chewing and swallowing. Difficulties and painful swallowing is common in those with head and neck cancers. A sudden change in your voice could also be cause for alarm. Our voices get deeper the older we get, but if you've noticed something strange happening with your vocal cords, it could be a symptom of mouth cancer. Again, many of these symptoms are linked to other issues like allergies, the common cold, or they could be an indicator of something else entirely. Only if you have more than one of the symptoms we just listed should you be concerned about mouth cancer. Causes and ways to reduce your risk of cancer. We just want to preface this by saying just because you've lived your healthiest life does not mean you're immune to getting cancer. Cancer can happen to anyone, but here are a few things that are known to up the risk of getting cancer and some things you can do to reduce that risk. Number 1. Don't smoke. Smoking holds a whole litany of issues from trouble with fertility to premature aging of the skin to cancer. It's especially common to see mouth cancer develop in those who smoke. Doesn't matter if you chew tobacco either, any way you consume it ups your risk of oral cancer. It's also important to be aware of secondhand smoke, as that can do harm and up the risk. Not to mention, going smoke-free will benefit your health in so many ways. Number 2. Cut back on the booze. Sometimes there's nothing better than cracking a cold one on a hot day. But if you partake in alcohol,